So I had my consultation on Friday and it went really well to the point where scheduling surgery sometime in the near future. I am excited. I'm a little nervous. I would be lying if I said I wasn't nervous. I've been dreaming about this day since I was like a little kid. Like, I know surgery doesn't make you happy. You've got to work on that, like in here and in the real world. My plans are to start everything new on the outside too. Just because I want like a change. I think that I've been stuck in the past, and with the past, I've been depressed. I didn't want to change anything because I figured, like, what's the point? But now that like I can just like wear whatever the fuck I want and go to like whatever, like yoga class, or go to the beach without, I can do things without having to tuck. I can have a different kind of sex. Like, I want to change other things in my life because I'm going to be happier now. Or at least I know for a fact that this surgery is what I've been wanting for a really long time. So that's my reasoning behind wanting to change everything. My surgery is next week on the 1st. And little by little, I'm chiseling away my to-do list. I still have to book a hotel. I've paid off my deductible, which is good. That was part of my list. And I've got to figure out how I'm going to pay for that hotel. I also need to find someone to help me during my recovery process, to take me from the hospital when I'm discharged to my hotel. I have little options. I can't ask my family, and I've isolated myself so much to the point where I don't have anyone I could ask. It seems like it's going to happen in like 6 days. Like, I'm gonna get my surgery. I'm so fucking excited. Right now it's 9:54. I fucking woke up so late, and so I think I might get there by 6 p.m., which sucks. God. So it's 6:33 a.m. and in 27 minutes, I'm not allowed to eat anything all day for 24 hours because my surgery is at 7 a.m. tomorrow. So I've got to fast. I'm only allowed like clear liquids, and I've got to start an antibiotic regimen at 12. I've also got to start a bowel prep today at 12. This is all like the day before surgery. Yesterday, I received a phone call that my insurance covered a majority of my surgery, but the co-payment was $850, and it was like a last minute phone call. It's 2 days before my surgery. Like, where am I supposed to get $850? I scrounged together some money. I'm just gonna have to like live tight for till next paycheck, I guess. And all day yesterday, I just wanted to like think. I was thinking about, I feel like I'm giving birth to myself through these procedures. Like, the mentality of it feels like I'm giving birth. Like, I identified as a woman before surgery. I just feel, it feels different. I feel different with this surgery. I do feel definitely 100% women with this surgery for me. There's like a miscommunication where people are like, well, you know, you've got a big decision. No. My decision was made years ago. The only thing that I'm thinking about is like aftercare, and, you know, when I drive back home, like, how am I gonna do that? You know, stuff like that. That's what I'm thinking about. I'm whispering because I'm in my hotel room. I just don't want to sound like I'm just like talking to myself. I actually ended up finding someone who's going to take care of me, and I'm really happy about it. So that little cookie monster is me, and that is who's going to help me recover after my surgery. I'm in my room now, and I feel like everything feels okay. I just feel like pinching, nerve pinching and all that. It is a big surgery. So it's to be expected, like there's pain and all that. I opted to get the vaginal canal thing because I do want to have sex. I mean, I think it went well from what I understand. Dr. Han is going to give his approval on the 9th, and I guess like with his blessing, I'm good to leave Dallas. The nurse is really nice. I did get a phone call like yesterday just to let me know what to expect, what I can bring to the hospital. I sound dehydrated. It's because I am. So I'm drinking like tons of water. Of course, I'm gonna stay inpatient for maybe 4 midnights. I don't think he's gonna release me sooner because there is some pain. My cousin should be here on my discharge day, which is gonna be on the 5th. So I'm like really excited about that. I went to go visit her at her job yesterday, and so far so good. I know surgery will not make you happy. That's never gonna happen. You have to work on it in therapy. You've got to work on it in the real world. So I'm looking forward to making those changes.